Entrepreneurship in the age of the coronavirus. Obviously, we were planning on being in New Haven shortly. Barb had almost an amazing number of wonderful things geared up for you. And they'll still be there when we can finally get there. It just won't be next week. Kimberly has just joined us. Kimberly, good afternoon. How are you?
Doing fine. Good afternoon.
Kimberly, we just introduced ourselves. Would you mind doing the same?
Yes. So good afternoon, everyone. My name is Kimberly. I'm a part of the marketing team, and I'm joining in to get great information that Rick has to share with us.
Wonderful. I'll figure out what that is along the way. And
Right.
Mike, just holler if at some point if you get your hookup.
I'm here.
You're here. All right.
I'm dealing with bandwidth issues, so each Zoom call I'm coming in with audio first, hearing you, and then my audio, and then video soon. But the bandwidth is terrible today.
Well, since we have your audio, go ahead and just tell us a little bit about yourself.
Sure. I'm sorry to interrupt, first of all, but I'm Mike Pantalone. I'm a senior research scientist at Yale School of Medicine, Department of Emergency Medicine. I'm also in psychiatry. Mainly focused on opioid and alcohol addiction. I have a small private practice, but the main thrust of my efforts these days is something called Recovery Pad, a text-based recovery coaching solution. So it's commercially available, but we're really trying to develop partnerships with healthcare systems and payers. And very excited to learn from all of you at this point.
Thank you, Mike. And we hope to see you as soon as your bandwidth resolves.
Thank you.
Scott Burwell, welcome aboard. Unmute yourself and tell us a little bit about you.
Hey, sorry for muting myself. So yeah, I'm Scott Burwell. I was part of the I2I 2019 cohort, and I'm working on a brain sensing platform for detecting craving in addictions during treatment. And currently in Minneapolis, hunkered down in my home. Sorry, I'm late to the call.
That's all right. You're welcome here. Thanks for dropping in. Laszlo, are you there? Unmute yourself and shout out.
Hi, how are you? Sorry,
Hello.
I had some technical difficulties here. So yeah, my name is Laszlo. I'm from Jupiter, Florida. Working with Courtney Miller on a drug development project. So the goal is to find some specific non-muscle myosin 2 inhibitors for the treatment of relapse of former methamphetamine use patients. I'm really excited to be part of this meeting, and I'm so happy, to be here. And I really hope we can meet in person soon, whenever this coronavirus situation will be over.
As do we all. Welcome to you.
Thank
you.
Well,
folks, thanks for the brief introduction. We appreciate it. No Brady Bunch jokes, except that I can't help but look at the screen and think of that song. So if I can get the song out of my head, I'll start to tell you a little bit about what we're going to do today. We thought that since we couldn't get together in person next week, and since we were postponing the event, that we'd use this time today to perhaps generate a sense of community among us and to see what we could do, if anything, reaching out to you to find out what is really going on with you right now in terms of your projects, your initiatives, how things are basically changed in this new age of coronavirus. Before we get to that, though, let me just recap. Many of you received the email that we sent out. Obviously, we're not getting together in person next week, nor are we doing this virtually. It was a conversation that we had among ourselves and the folks at NIDA at length, going back and forth, trying to figure out what the best thing was to do. And at the end of the day, we decided that there was really too much riding on the personal interactions that we had seen become so valuable to previous cohorts of fellows, that we didn't think that throwing it together, and it would have been throwing, no disrespect, but it would have been throwing something together to try to maintain a semblance of the program we had for you and doing it remotely. And P.S., if any of you have seen CNN or MSNBC try to throw things together, you know it all doesn't work out just as planned, and they're pros. I think we're going to probably be better off for doing this in the fall. Having said that, as you followed current events, there's no guarantee we're going to be able to have it in the fall, but we'll have to see how that happens. We have two things that are, frankly, are headwinds for having this in the fall. One is the resolution of the crisis, and the other is that everybody who has been affected in March and April looks at the calendar, they say, let's do it in the fall, which doesn't really account for all the things that are already in the fall. As I said to someone, if you say have it in September, September gets a vote, and September is already booked. So we're going to have to see how this all works out. But fingers crossed, if we can resolve those two issues, we plan to have this in New Haven in September. But as they say, watch this space. Meanwhile, we certainly hope that everyone with us today is healthy. We certainly hope that everyone today is washing their hands, to say the least. And if anyone has anything to say during this call, we certainly want to hear it. But we thought we'd start off by just asking you, what's it like? And are there good things and bad things about this hiatus, at least in terms of person to person, such that your venture is either hampered or in some cases might even be helped by circumstances that have been brought up by this coronavirus? If anybody wants to jump right in and just tell us about how things are going, please feel free. Those of you on video can just raise your hands or whatever you want to do. I see a couple of smiles, so some of you have some ideas that you'd like to share. Don't all go at once, but somebody go. Yes.
Yes. So there is a silver lining for us. I mean, being a telehealth solution for opioid use disorder, I think I've gotten more attention from colleagues and friends who are going to connect us to angel investors because the regulations are being relaxed almost hourly around telemedicine, telehealth, and our solution focuses on bringing a very helpful medication for opioid addiction via a telemedicine solution and a recovery coaching texting platform. So I'm more hopeful now, given the relaxing of these regulations. I don't know how long they will be relaxed, but I think this is the pilot test around relaxing those regulations that people have been frankly fearful of doing for a long time. And I think some of those relaxed regulations will remain relaxed even post-coronavirus.
Wow.
So that's good.
Some of the regulations that are being relaxed, are they ones that in hindsight probably needed relaxing in your view?
Yes. So
well, sorry, go ahead.
No, please, Jane.
Well, I think it's two pieces. It's the regulatory environment sounds like it's changing, but also so many more people are now having experience with telehealth, video communication, that people are maybe going to be much more open-minded. The investors are going to become much more comfortable with it, and will be able to feel more confident about investments in that space, as well as providers, as well as patients, as well as payers. Right? Because there's really a payer component there too.
Absolutely. So it's topical. It's making everyone feel more relaxed. There's a great need. I mean, my patients from my practice, even the ones who are not comfortable with Zoom, are like, I need my session. Yeah. I need this to happen. Other people are saying, I'm in a cramped space with all these people with so little bandwidth or even privacy to do video. They're now trying the texting platform that we have.
Interesting. Okay.
I mean, out of hard times, you got to look for the opportunities. So,
thank you, Mike.
Thank you.
Anyone else have a story to share about what's going on in their world? Yes, Dr. Toledano.
Yeah, having more comfort with telecommunicating is a great silver lining from this crisis. Today I saw 10 patients on the phone, and it was great. They were so happy to hear that someone's checking on them. as far as my project, the medication that I've been working on for 10 years, which I believe is a great medication for neuropathic pain, it hit the roadblock with the NIH because frankly, I think they're blacklisted naltrexone for pain. It now can have another chance of getting public funding through its possible effect on reducing the severity of viral infections in the COVID-19. And so I found three other toll-like receptor 4 antagonists that had amazing results in preventing lethality in mice from influenza. So I'm working on maybe a proposal for the Gates Foundation for a treatment for the COVID-19. I'm taking it personally. And personally, I think I already had it. On February 25th, I started having a head cold. And 5 days earlier, I had a movie crew in my office, and there were 25 people crammed in the back with in the hallways. And those people were from London, New York, and Miami. And I felt something going on in my nose. My nose was dripping, and that was weird because my nose is always dry. But that 5 days later, I had a full-blown upper respiratory infection. It stayed in my nose, didn't go to my lungs. For 3 weeks, it was quite severe. So it looked like my body really didn't know that virus, because I never get colds. I'm exposed to patients all the time. In the last 30 years, I never had a cold. So I think that maybe being on my medication prevented me from getting lung involvement. But if we get the ability to test for antibodies, it would be interesting to see if I have them.
Are you feeling better now, Dr. Toledano?
I'm feeling great, yes. I'm feeling great. I worked through the whole thing. It really never affected never gave me body ache, but it lasted for 3 weeks, but it's been 4 weeks. So I'm feeling totally normal now.
Good.
But I'm still careful. When I go out, I'll wear a mask and gloves, and I'm in my office, but I'm alone here.
Yeah. I'm glad you're feeling better.
Interesting, yeah.
It's interesting.
Please, Andrew, go right ahead.
So we had been working for the last 3 years as part of a large PCORI award on a 12-site study treating hepatitis C and 12 methadone programs throughout the state, 6 in New York City and 6 upstate, geographically spread out. And the situation now in New York State is really amazing because all of the infections are centered around New York City, Westchester, and Long Island, and a little bit in Rockland, and virtually very few. I mean, in Erie County and Buffalo, where I am, we have 160 as of today. Syracuse and Albany are very similar. So we had been working on a statewide telehealth network, or getting that up and going. Our study completed 3 years of recruitment last month. And so 602 patients total, comparing usual care, which is referral, to telemedicine. And I've been thinking, and part of the reason for wanting to attend the Yale program was to get to understand how to make this a commercial endeavor for treatment of Hep C and HIV, because telehealth really facilitates treatment for those viral infections compared to offsite referral. And if any of you are aware, treatment of Hep C has really improved over the last 3 or 4 years, where it's now 1 pill once a day for 2 or 3 months. Almost everybody's cured. So it really sets itself up for a telehealth intervention. But what's interesting is that now with the COVID-19, that provides a business opportunity, perhaps, or at least an opportunity to start thinking about using telehealth as a way to triage patients, which is a huge problem in New York State right now. And they're asking for providers, recruiting retired providers. I mean, really trying to surge up the healthcare infrastructure. And so I'm trying actively right now to figure out how a telehealth solution might be able to leverage and meet that need.
Got it. Got it. Does anybody think, and I still want to hear from anybody who wants to volunteer their current experience, but we've heard a couple of mentions of telehealth. Does anybody think, folks who mentioned it or anyone else, that this not only is an opportunity for telehealth to ratchet itself up in terms of its usage and its awareness, do you think that's going to engender what might be the expected effect of also attracting additional competition?
Yeah.
Is everybody going to want to get into the pool?
I think so. I mean, in discussing this with a couple of, you know, I know one of the large telehealth companies is racing to implement a COVID-19 solution. So I think it's going to change, but telehealth has a lot of different nuances. I mean, and certainly I would imagine, Mike, you have a different perspective, you know, seeing patients who are addicted versus I might have treating Hep C, which is a 3-month treatment. And so, and lends itself less to, let's say, a chronic relationship. There are abilities to bridge healthcare disparities with this opportunity. There's, you know, whether you're active and whether you put an advertisement out and let people come in, or you try to do it in the way we've been doing it, which is go to the methadone programs where opioid use disorder patients naturally go, and availing themselves of primary care in that setting. You know, I mean, which could be leveraged for other types of situations where people congregate. So I think telehealth and telemedicine, there's a lot that we don't yet understand about how it could be used. And I think this offers an opportunity, not only for the relaxation of regulation, perhaps improvement in reimbursement, as Mike discussed, but also the opportunity to think about innovative ways in which we can engage patients.
I agree, and I think if we use telehealth as the umbrella term, I know there are a lot of terms in here, and telemedicine is one part of it. Text-based solutions that give patients even more anonymity and give us even more efficient ways of finding and engaging patients in different places, even if there is no congregation, as you put it, is another component of it. And there are a number, I think, you know, the market's not saturated yet, but people have been working on telehealth Cube for a while now, but they're largely bringing in the brick and mortar model and just digitizing it.
Yeah.
They're not taking full advantage, I think, in my humble opinion, of the telehealth capabilities. But now there are primary care-based solutions that started with text, but are now based on natural language processing, artificial intelligence that takes the heavy load of engaging the patient easily, privately, and starts by triaging them. And then as they want and as they need, they get connected text-based with the physician. So I think we're going even farther ahead than just viewing each other in live synchronous time. I think I think we need to stay on top of all of what the broad telehealth term is.
And that's what
in
I
my
meant,
opinion.
Huh?
In my opinion.
No, but that's what I meant in terms of innovative ways in which we can use it. I mean, what about, you know, we've done some mining, you know, predictive analytics there's a regional health information organization here that has data on about 1.2 million people in Western New York, identifying patients and then, you know, in those solutions. So I agree with you that telehealth will, I think the more that there's an interest and involvement and a spotlight on this as a technology, I agree with what you said. In other words, it's been brick and mortar. The number of practices that are now performing telehealth has skyrocketed in the last 2 weeks in this environment.
Well, I'll tell you, I'm encouraged, for one, to hear that there are opportunities born of this. I was afraid that everything would be challenges. So it's wonderful to hear. Meanwhile, if there's anyone else who is experiencing challenges because of these uncertain times and because of the quarantine and stay at home, please speak up and let's hear what you're encountering.
I guess it's just been a challenging, you know, because I'm still at this stage of really trying to hone in on our target customer and figure out who that is. and also, figure out the value proposition for them. And so, this whole shift of like calling up people, interviewing them, sometimes I think it's rubbing people the wrong way because, they're like, you're tone deaf because you're calling me asking about, these things that you're curious about that have nothing to do with COVID. Can't you see the world around? So like, in some ways, I think that like that has happened to a couple like times that I've called people. But then, it's totally unpredictable. Other people are just like, oh, I've got all the time in the world now to talk to you about this stuff. Like, so fire away. And so, that's been a challenge to navigate. But in general, like, this whole, this intent, increased focus on telehealth type things has also kind of pushed me to rethink some of how I might use my innovation that we're working on here in a more remote setting or in a telehealth type way. We're using, of course, some added hardware, using a brain sensing headset, which, some of the, like what we intend to build our prototype based on is something that's fairly expensive, about $1,000, but, they have some that are $100 or something like that, and it can be applied to like some of the, as a wellness method. And there's a lot of people that already spend this money as a means for doing sort of meditation type exercises and stuff like that. So I'm thinking about how to use those EEG headsets that are already out there. They're relatively inexpensive, potentially to, sort of shift our customer focus to those that are susceptible or that are receptive to sort of this telehealth. Because as I've talked to a few therapists out there, this increased isolation, this being stuck at home and not, feeling safe going outside in the world is, for many people that have addictions is a major stressor. And so, in any way that we're trying to like figure out how we can sort of pivot our idea, at least, to turn this lemon into lemonade of sorts, that's what we're looking into now.
Wow. Thank you, Scott. Appreciate that. Hey, Sarah, would you mind sharing? I just full disclosure, Sarah and I chat more than frequently about her business, but we haven't lately. And I know at least that you're the stage of your involvement, you are very heavily involved in what we would call business development or sales.
Mm-hmm.
What has happened as a result of the current circumstances to your effort?
Well, I was just about to chime in, so I'm glad you did. It's been an interesting time. So one of the things that both Rick and Janie have been really supporting our sales efforts, and the place where we had been doing the most networking and work was in the sort of northern New Jersey area. And so right now in particular, that's a pretty hard hit area. Everyone, very close to New York City, as all of you know. And so schools are, I should actually back up, our digital prevention programs, our primary customers right now are schools across the country. And so schools right now have been doing a rapid shift and pivot to remote learning and to distance learning opportunities via Zoom, and like all of us are. So I think the upside in the long term is that people are getting firsthand experience of digital ways of communicating and navigating the educational space that they didn't have comfort with before. And I think there's a need for prevention programming that is digitally based that people are recognizing more. But our sales efforts largely haven't been moving very much. So one of the things that I did do is I reached out to all of the people that we've had a lot of communication with. So we have 2 current clients, several that were in the works for this academic year and several that are in the works for next academic year. And some that are promising, but we're not sure. And so I personally reached out to everyone to check in and expressed more of our care for sort of where they are, what they were facing, health of their academic community and families, and just offered our support in any way. Most of them said that the next month was going to be pretty overwhelming because they're doing this transition to virtual classroom. and there's a lot of uncertainty and, planning involved in that. And so we've bookmarked times to talk in the coming weeks. I've been doing some homework about who we could reach out to introduce ourselves that might be interested, but I've wanted to just be mindful of what everyone's grappling with right now, and sort of along the lines of, Scott, what you were sharing, I want to be sensitive to everyone's experience. And so I think that we're, depending on the geographic location, considering reaching out in the coming weeks to give folks a chance to breathe and care for themselves in the way that they feel like they need to as well. So it's interesting. So the feedback we've gotten from some is a lot of appreciation for our outreach and checking in. A lot of folks that sounded promising that we weren't sure have said very specifically, we plan, once we've transitioned, on cementing our plans to implement your programs next year, which is great. And then we've also had some person-to-person recommendations where folks have been introduced to us who are going to a new school, or, because digital programming is on their minds, want to learn more about us. And so as those have, just a few have been coming in, we've been scheduling appointments and meetings and pitches, but the sales part has been a little bit slow, just given the current state of affairs. And to be fair, part of that is also on our end. I'm home, my whole family is home. There was a question of whether we had been exposed through my kids' school to COVID, and thankfully we just found out that that isn't the case. So I've also been a little bit occupied, but we're healthy and well, and I'm personally, I think, just gathering myself for this next effort. So, yeah.
Got it. I certainly imagine that since you're contacting educators, some of them have varying degrees of, as we would say, other things on their mind.
Yeah.
We've already mentioned wonderfully that telemedicine seems to be having a moment. Similarly, I'll bet so does distance learning. And